Hello and welcome to How to Deal with Grief and Trauma. My name is Natalie Himmelrich. How to Deal with Grief and Trauma is completely self-funded, produced and edited by me, Natalie Himmelrich. Consider making a small donation to support the podcast. Go to bit.ly/support, capital G, capital T, and podcast. I repeat, bit.ly/supportgt podcast. Thank you so much. And for more information, please visit Natalie's website, join the podcast Instagram page, and subscribe to the newsletter to receive updates on future episodes. Welcome to this special series on the many faces of trauma. In each episode, we'll explore one trauma type in a clear, gentle way, what it is, how it can show up in daily life, and one small step that can help your nervous system feel a little safer. Nothing here is meant to diagnose you, and you're always invited to take what fits and leave the rest. And because this is trauma work, we'll end every episode with a short grounding practice you can do anywhere. Today, we're talking about medical and birth trauma, when an experience that was meant to help, heal, or bring life also involved fear, loss of control, or not being listened to. This will be general and non-graphic, but it may be tender. You're welcome to pause, step away, or return later. Medical and birth trauma often comes with its unique kind of loneliness and can feel especially isolating. It is because people will sometimes say things like, "But you're alive," "But the baby is healthy," "But the procedure worked," "But the doctors were doing their best." And while those statements can be true, they can also erase a person's lived experience. Starting a sentence with the word "but" invalidates the first part. You're hurting, but you're alive, which then means you shouldn't be hurting, or it's okay because you're alive. So medical trauma is not always about an outcome. It's often about what it felt like in your body while it was happening. Fear, powerlessness, exposure, pain, confusion, being restrained, rushed, or not informed. Being spoken about rather than spoken to, or not having a voice. And if a person's nervous system encodes the experience as, "I wasn't safe and I had no control," it can leave a lasting imprint, even when everyone around them wants the story to be purely positive. So today we name this gently, clearly, and without blame. Let's start with a simple definition. Medical and birth trauma occurs when medical care, a procedure, illness, injury, pregnancy, birth, or postpartum events overwhelm the nervous system, especially when there's fear, helplessness, loss of choice, or violation of consent. This can happen in many contexts, for example, in emergency situations, when there is a painful or invasive procedure, but also during anesthesia experiences or in ICU care. It may also happen when there are complications during pregnancy or birth, or when there's unexpected interventions. Also infertility journeys and repeated medical appointments, or if you had experiences where symptoms were dismissed or minimized, and moments where a person feels unheard, unsafe, or powerless. It can also happen when the body is already vulnerable, exhausted, hormonal changes, high stress, or has a previous history of trauma. And sometimes it's not one moment, but a series of medical stressors that accumulate over time. During this episode, I'll share a couple of micro stories for you to understand. The first one is about a medical trauma. So imagine someone who has a procedure that is described as routine. They arrive anxious, but they're told, "You'll be fine." But things move quickly. They don't fully understand what is happening. They might feel exposed and rushed. And they try to speak up, but they're met with impatience, like they're making it harder for everyone. Afterwards, they can't explain why they feel shaken. They tell themselves they should be grateful, but their body is jumpy in medical settings. Their heart races in waiting rooms, they avoid follow-up appointments, or they feel panic when they smell disinfectant or hear certain sounds. The outcome may be successful, but the nervous system learned, in that context, I had no control and no safety. The hidden core: consent, control, and dignity. Medical and birth trauma often centers on 3 nervous system needs, which are consent, control and choice, and dignity. Let's have a look at them individually. So first of all, consent isn't a signature on a form. Consent is an experience which can be experienced through being informed, being asked, being respected, and being allowed to pause or adjust. The second one, control and choice, because even small choices matter to the nervous system. And choices can be given by asking someone, for example, would you like to sit or lay down? Or do you want someone with you? Another question could be, do you want me to explain each step? Or you can get choice if you ask, can we pause for a breath? When choice disappears, the nervous system can go into survival. And the third need is dignity, because how you are spoken to matters, how your fear is handled matters, and whether you are treated as a person, not a task, that matters. And this is why people can feel traumatized even when staff were technically competent, because competence doesn't automatically equal safety in the nervous system. The next story is someone who went into birth expecting to be informed and included in decisions. But once things sped up, the room filled with people and urgency. Conversation happened over them and not with them. They heard unfamiliar terms, felt their body being directed, and realized no one was checking whether they understood or consented. Afterwards, everyone said, "You did it! How amazing!" Yet inside, they felt shaky and detached. They couldn't explain why their chest tightened when they thought about the birth, or why they avoided talking about it. But their body remembered the speed, the urgency, and the loss of voice, more than the outcome. And that's one pathway into birth trauma, when help arrives, but agency and dignity disappear. Another birth story is where we imagine someone who didn't get the birth experience they hoped for. They felt sadness and loss, maybe about how their body responded, or what choices were taken away, or maybe what they had imagined birth would be. And alongside that grief, there was fear, like moments of helplessness, panic, or disconnection. So when people afterwards say, "At least you're both okay," these people might have felt guilty for struggling. But 2 things can be true at once. You can feel grateful and traumatized. You can love your baby deeply and have a nervous system that learned that wasn't safe. When grief and trauma get tangled, healing often starts with permission to name the whole truth, without being talked out of it. So these are 2 common threads in birth trauma: loss of agency in the moment, and the way grief and trauma can coexist afterward, especially when people unintentionally minimize your experience. Now let's have a look through the polyvagal lens and why the body reacts later. From a polyvagal-informed perspective, medical settings can activate protection for a very understandable reason. You're often or always in an unfamiliar environment. There are bright lights, cold surfaces. It comes with vulnerability and exposure, and often includes bodily sensation you can't control. Also, you're giving at least some authority over your body to someone else. And often there's urgency and unpredictability. So as we know, the system can move into two different ways. One is mobilized protection, which is the fight or flight reaction, and the other one is the shutdown protection. So let's have a look at how it can show up when you're feeling mobilized. You might feel pain, agitation, a racing heart, or feel anger, irritability, or urgency. Your system is scanning for danger, and you might have experienced insomnia before appointments. If your system may go into the shutdown protection, there's often a sense of numbness, freezing, dissociation, or difficulty speaking up and going compliant, or a sense of feeling detached from your body. And many people carry shame about these responses. They may ask themselves, why didn't I speak up, or why did I freeze? But freezing is not weakness. It's a survival response when the system perceives no safe way out. Now, obviously, those two ways the system can move into can also change. It can move from one to the other. And a helpful phrase is, my body did what it needed to do. So how medical or birth trauma can show up in your body. Common patterns include, for example, panic in medical environments, nausea, dizziness, tight chest, an increased pain sensitivity, sleep disruption, or a startle response with certain sounds and smells, as I said before. In behavior, it can show up as avoiding care or delaying appointments, researching obsessively to regain control, or needing a support person always, or having difficulty trusting providers. Emotionally, it can show up as fear, anger, sadness, grief, but also shame for feeling ungrateful. You might feel betrayed by the body or feel disconnected from the body postpartum. Some sentences you might hear yourself think or say to yourself, my body isn't safe, I'm not in control, or no one will listen to me anyway. Again, remember, these are patterns and not diagnoses. Now let's move into what helps. Here are some practical, empowering, and gentle, hopefully doable ways that you can support yourself. First of all, reclaim choice in small ways. So before appointment, you could choose who comes with you, what questions you'll ask, and what you need to have explained, even a pause signal, and your aftercare plan. 2, build a script. Some of the phrases that help when the nervous system goes offline, and you might like to write these down, are, please slow down and explain the next step. Or, I need a pause for 1 minute. Another one is, I'd like a support person present. Or one that I always use when I go to the doctor and have something, even something small, is, can you please tell me what you're doing before you do it? Then the third part is to debrief rather than dismiss. A short debrief can help you integrate what has happened. So ask yourself, what was the scariest moment? What did I need that I didn't get? And what helped even a little? And then 4, it's good to reconnect with the body gently. For that, choose a safe, non-invasive reconnection, which could be through a warm shower, putting your hand on your heart, to do some gentle stretching, or wrap yourself in some soft clothing, or do some breathing, especially with longer exhales. And the last step, if these feelings and experiences persist, really get some trauma-informed support. Therapies like EMDR, somatic therapies, or birth trauma specialists can help. So for today's grounding practice, which I call resource breath and choice point, this is designed for medical and birth trauma. And it is by emphasizing choice, which the nervous system often lost during the experience. Step 1. Choose a resource image. Bring to mind a simple resource, which can be a place, object, or memory that feels neutral to good. It could be a mug of tea, a blanket, a window view, a person's kind face, anything you like, but keep it simple. Step 2. I'm going to give you 2 options for breathing. Choose which one of those feels better to you. I mean, you might like try them both. I'm going to explain them, and I recommend that after the explanation you pause this episode, try it out, and when you're ready, continue with the episode. So option A is inhaling for 4 and exhaling for 6. So gentle, longer exhales, which always help the nervous system relax. And do like 3 to 4 rounds. Option B is inhaling normally and then sigh out slowly. And again, do 3 or 4 rounds. I'll repeat again. Option A, inhale 4, exhale 6 with gentle, longer exhales. Option B, inhale normally, sigh out slowly, and again, both 3 to 4 rounds. So make a pause here and try it out. Step 3, your choice point. Now say softly to yourself, right now, I have choices. And name one small choice you can make today that supports your body. It could be water, food, rest, asking for help, setting a boundary, or taking a pause. And step 4, hand support. Place your hand either on your chest or upper arm, or both hands on both upper arms, whatever feels supporting for you, and say to yourself, thank you, body, for protecting me. If you'd like support as you move through this series, check my website for the free resources offered for both those affected by grief, loss, and trauma, and those supporting them. Next episode, and the topic is when the environment is the threat, chronic stress without an exit, and how that shapes the nervous system over time. Until then, stay safe and take care. Thanks for listening to How to Deal with Grief and Trauma. If you'd like to be updated on future episodes, please subscribe to my newsletter on nataliehimmelrich.com. If you need grief support, please contact me for a 30 minutes free discovery session. How to Deal with Grief and Trauma is produced and edited by me, Natalie Himmelrich. To support this podcast, please rate, review, and subscribe to or follow the podcast on Apple, Spotify, or wherever you get your podcasts. Thank you. And remember to keep breathing. I promise it will get easier.